Okay, I think we're ready to go. Good morning, everybody. Welcome to Kalamazoo Venture Tuesday. Everyone, do me a favor, please mute your microphone when you're not speaking, but do feel free to leave your camera on. We like to see smiling faces. For those of you who have never joined us before, Kalamazoo Venture Tuesday is an opportunity to see inside the minds of investors as they provide feedback to our company presenters. The purpose of Kalamazoo Venture Tuesday is not to secure an immediate investment, but rather it's a teaching opportunity for the participating companies and for members of the audience. Each of our quarterly meetings features a panel of 3 active investors and 3 startup or early stage companies. Each presenter will have 10 minutes to pitch, followed by 10 minutes of feedback from the investor panel. We'll not be taking questions from the audience. However, you may ask a question or make a comment in the chat, and that's located in that little conversation bubble in the top bar of your screen. So for those of you who don't know me, I am Sandra Cochran. I'm the Assistant Dean at the WMed Innovation Center. We are the proud hosts of our quarterly Kalamazoo Venture Tuesday meetings. Happy to have you all here. I have a great panel today of 2 new panelists and 1 returning panelist who's been with us before. So panelists, I'm going to go through our list and ask each of you to unmute and introduce yourselves and say hello. I'm going to start, Rupert, with you. If you can unmute and introduce yourself, please.
Yes, hello. Thanks for inviting me to do this. So I'm Rupert Vessey, and I'm currently Chief Scientist for Flagship Pioneering, which is based in Boston, although I live in Kalamazoo. And before that, I was President of Research and Early Development at Celgene and Bristol Myers Squibb.
Awesome. Thank you. We also have Matt Okoneski. Am I saying that correctly, I hope, with Red Cedar Ventures?
You nailed it. Hi, everyone. My name is Matt. I'm a Director of Venture Investments for Red Cedar Ventures and Michigan Rise. We're early stage investors that focused on Michigan-based companies and those that have affiliations with Michigan State University. I've got a life science background myself, and so I do all the healthcare and life science investing for our funds. Pleasure to be here today.
Great. Thank you. And our last panelist returning has been with us before, Steve Tokarz. Say hello, Steve.
Yep, Steve Tokarz from Cantilever Investors. We're here in Ann Arbor, Michigan. We tend to invest in the Midwest. We're a tech, early stage focused company. But in addition to investing into companies, we try to put in smart money. So, we'll help the companies either, find co-investment, raise capital, or sometimes we can plug ourselves in. Matter of fact, I still help run 2 of our portfolio companies. We don't necessarily set ourselves up in life science, but we get brought heavily into the life science space with a lot of the companies we could help. So one of the portfolio companies that I actually help run is a company called Peptinovo Biopharma, early stage cancer company. So we understand how to raise the money as the operator, we understand how to invest the money as the investor, and then the bridge in between.
Great, thank you. So as you can see, we have 3 very seasoned and very diverse experienced investors joining us today. So we have an exciting lineup of 3 early stage companies that are going to be pitching for us. So we are going to kick off with ladies first. We're going to start with Valerie Obenchain from Ayers. So Valerie, if you will go ahead and bring your slides up. Excellent. And you're in presentation mode. Okay, you have 10 minutes. You may proceed when you are ready.
All right. Well, my name is Valerie Obenchain, and I'm a registered respiratory therapist by trade. And I really seen firsthand the need for oxygen solutions and innovations. This is my grandmother. She has COPD, and she wore oxygen 24/7. So it kind of gave us like a unique aspect to the issues that the oxygen users were facing on a daily basis, both as a caregiver, but also as a family member. So this is not just a problem that I've experienced. This is a huge problem. So COPD is the 3rd largest cause of death worldwide. So in the US, it's the 4th largest cause. So it impacts 400 million people in the world. So with this being, it's chronic obstructive pulmonary disease. And with this being a chronic issue, many of these patients will eventually have to rely on supplemental oxygen. So currently there's 4.2 million oxygen users in the United States. So the problem is there's very little monitoring once these patients leave the hospital. So a lot of them are readmitted to the hospital within 30 days, and that means their bill isn't fully paid for. So this is kind of the patient's journey. They start out, they get short of breath, they go into the hospital, and then they get evaluated for oxygen, get a prescription for oxygen. The insurance company is involved with the discharge planner. They select the O2 supplier, and then they're sent home. But after that, nobody's really monitoring these patients once they're sent home. So they're kind of left to their own devices, and they have to monitor themselves or have like a loved one or a family member that's doing that monitoring. So our solutions, we're the first to remotely monitor both the oxygen supply and the users. So we're started out with our oxygen flow monitor, which basically is used downstream on any oxygen supply. What's really unique about this is we've actually got that new remote monitoring platform. So we have a team of respiratory therapists that can do the remote monitoring for these oxygen users. So when the oxygen user is in their home, they're still being monitored by respiratory therapists. So, and we've continued to innovate. So currently we're working with Michigan Tech University, and we're actually doing a new business unit of AIRS called O2 Innovate. And this is to focus on our new innovations. So like our oxygen concentrator. So they're working with the university as a partner to help them do some prototyping for our next generation device. So this device will actually produce its own oxygen and then have the remote monitoring features as well. So our app portal looks like this. Here's a sample of our dashboard. What's really different about the pulse oximetry technology that we've integrated into our devices is we even transmit the PPG waveform. That helps a caregiver like myself to really make sure that it's quality data that we're receiving in our devices. So currently we're a lot different than what's available on the market today. So we've kind of taken a different perspective on the problem and the solution. So we're the only one that continuously monitors. We're the only one that has the Wi-Fi transmission. And a lot of time it's really the patient or the caregiver that's still just monitoring those devices. Oops. What's really neat about our remote monitoring is because it opens up a new revenue stream for oxygen users. So years ago, oxygen was bundled, so there wasn't a lot of reimbursement, hence there wasn't a lot of innovation in this space. But now with the remote monitoring by respiratory therapists, it unlocks a new reimbursement stream for us, in which we can receive over $200 per oxygen user each month. So here's our total market. Here's the 4.2 million oxygen users, but we're really focused on that 300,000 that are high risk for hospital readmission. So the total market is an $18.6 billion market, and that's just the US market. And it's a growing market as well. So our patents are now issued. We have 3 US utility patents that are issued in the United States. We did a patent continuation. We actually have 2 patent continuation and parts that are underway. Our original PCT filing is now issued in 20 countries. So we have strong IP, and these include like on average about 50 claims in each of our patent filings. So AIRS is classified as the spec developer. So it's our ideals, it's our designs. And when we're working with Michigan Tech University, we actually buy the IP from them. So we actually own all the IP as well. We use third-party contract manufacturing services. Currently, we've been working with Into Being. And then we get our we partner with like the distribution channels, including the oxygen suppliers, to get our devices into catalogs such as Cardinal Health and CareLink. So the business model for our devices is, we have AIRS kind of at the center of it, where we're kind of exchanging data for money with the remote monitoring features that we have, but also with our app platform as well. So what's really unique about the app platform is it allows not only caregivers but family members to remotely view their loved one. So like for my grandmother, I could go on the app and view her oxygen status anytime and even get a text message alert if anything was outside of normal parameters. So here's kind of our basic go-to-market plan. Currently, we're working on our oxygen flow monitor and our 510(k) submission for the FDA. We're doing all the verification and validation testing that's needed. We're actually currently working on 2 pilot studies right now, one with CareLink and one with Henry Ford Hospital for this device. So, and we're still working with Michigan Tech University for the oxygen concentrator, which is earlier in development. We plan on launching that at about 2027, but we'll be ready next year for the oxygen flow monitor. We really worked hard to put together a great team of people. You have myself. This is my full-time job, but we also have Rob, who's recently joined us as helping us with as a chief commercial officer. Diana, who's been with us just about from the beginning. She's also an investor on our team, is our CFO. Adam, he's my first electrical engineer that I hired early on. And Greg Lass, he's our regulatory expert who has done all our filings. So we put together a great advisory team as well. We've got people with many years of experience, over 200 years of experience. Then they've really helped us to get our devices and our products to where we are today. So we've got multiple collaborators that we've worked with in different spaces, both here locally in Michigan and all around. So, and we were looking to add more collaborators to our screen here. So currently we're raising $2 million round, and that's to launch our oxygen flow monitor. So you see 750,000, that's for a run of product, another 750,000 to complete the FDA testing, including all the verification and validation testing. We're also working on those 2 pilot studies, and then $500,000 for hiring a new salesperson and also for marketing expenses. So Ayers is already an FDA registered company. We've launched our moisture exchange tubing, which is the first portable humidifier. So that is an FDA Class 1 product, and we are now available on the GSA schedule. So we're working to sell this device to the government currently. Here's kind of what we're looking at this year. We're looking at only about 500 of the moisture exchange tubing, but this could change. I've actually had some really good meetings lately, so we might exceed that is our hopes here. So, and then launching our oxygen flow monitor next year. The subscription is that app, and then how many months of insurance reimbursement, and then we could see the oxygen concentrator for a launch in 2027. That'll be probably towards the end of 2027 as well. So our ask today is we're looking for more collaborators. We're actually looking for somebody to help run our new business unit of O2 Innovate and work directly with Michigan Tech University. We're always looking for connections to pulmonologists and oxygen suppliers, and anybody interested to come and join our fundraise here. Thank you so much.
Awesome. Terrific job. Thank you, Valerie. I'm going to go in reverse order, Steve. So I'm going to start with you, please. What kind of feedback do you have for Valerie today?
Good slides, Valerie. You hit all the key points. Couple quick questions. When did you start the company?
We've actually been in business. It's almost, we just celebrated 10 years. We're actually pushing 11 years at the end of this year. So.
Did you present to Blue Water Angels in the past?
I did a long time ago. It was one of the first ones I think I presented for. So it's been quite some time. I would love to come back and present for them again.
Well, and the only reason I brought it up is I was at that event that you presented, and you've come a long way since then. So congratulations. Who are you working with at Michigan Tech?
So like Nate Yater, he's kind of one of my advisors there. I've been working with the AMP accelerator, and I was in the capstone program, and now I'm going into the enterprise program there at the university.
Are any students and faculty then doing the design work?
Yes,
who's
we
the
do
lead,
have
who's the
some help
lead
there.
faculty member?
Len Switzer would be kind of the faculty lead there.
Got it. Well, a bunch of questions on the business model, but I'll hold off. But good start.
Thank you.
Okay, thanks, Steve. Matt, we're going to go to you next.
Sounds good. Steve, that was a perfect segue. As I've had the benefit of seeing Valerie quite a bit here. She's in our Conquer Accelerator recent cohort, but yeah. So let's talk business model. And actually, if you don't mind bringing up that slide, that would help, because there's to your credit, you're exploring a number of different revenue streams that kind of take this out of the durable medical equipment, single sale type opportunity, which I think does provide some interesting value. But just want to talk through a couple of assumptions. So help me understand the family member alert subscription piece here, and kind of how you view that rolling out. Is that HIPAA? Do you need HIPAA compliant software? How does all of that work?
Great question. So for the family members, we were going to make our app available, and the family member has to have permission to receive that information. And we don't put any like protected information on there. It's just basically just seeing their oxygen status is all they're able to view. They're not able to make any changes to that data. And the family member, they can actually revoke those privileges as well. So if they said, hey, I don't want my granddaughter or my son or whatever seeing that information, they can revoke their privileges. But they sign up on the app portal, and that'll allow them access to to just like view the data and to even receive a text message alert.
Got it. Have you kind of talked with a regulatory expert that has experience in medical software? I do think, not an expert here. I know enough to be dangerous. But when you say oxygen status, is that like a green, yellow, red, or are you actually showing partial saturations? Because even the name
Yes.
itself is protected, but certainly the therapy that they're getting would be protected, I think.
Not here, because we're oxygen flow. The pulse here in the United States is not protected data. It is considered
okay.
in Europe, though. So
Okay.
all we're doing and what's key for the FDA is we're redisplaying data. Is one of the key things that they say. So so the same data that's kind of at our device itself. So the oxygen flow, the patient's SpO2, pulse. We also track how many full versus how many empty oxygen tanks. So that would be the data, battery life as well, but that would be the data that would be displayed on your device, also sent through the app portal. On the app portal, you do get to see a little bit more though, because we actually transmit that PPG waveform and things as well.
Got it. I did not realize PPGs were not covered. So you've done your homework there. Great job. But is it normal for COPD users, as a standard of care for COPD and other oxygen users to wear, in the picture with your grandmother, you had a PPG, finger unit. Is that typical that they would wear that 24/7?
They don't have to wear it 24/7. More when they're exercising, but we do at least every 8 hours. We at least need to get some data points every 8 hours and stuff. But they don't have to wear it like all the time and stuff. The flow is continuously being monitored, and they don't have to wear anything to monitor that. But for the pulse oximetry information, they do have to wear a sensor. And there's a couple different types of sensors to choose from. So we have the finger one. There's the ear one. There's actually like a refractory one that you can wear like in your forehead.
Yeah.
So so there's some different types of probes that they can utilize.
Sure. There's an interesting, you're getting compliance data as well. So that's another interesting piece. But I know that my time's probably short here, but I am curious about the reimbursement. So you've got, this as a revenue stream for the company. So does that mean you're going to be staffing with respiratory therapists and they're going to be reviewing this data, or what does that mean for the business?
That is actually a really great question. So yes, AIRS is going to be doing some of the remote monitoring, but in some situations, so right now we're having conversations with CareLink. We're doing a pilot study with them, and when they purchase our device, they want to actually own the device and do their own remote monitoring with it. So we were just actually working on updating some financials to really reflect that too, upon the new information that we found out, because it is a nice new revenue stream, and they're going to want to do that monitoring, and we're okay with that too. We looked at it and stuff, and it's about those. They have direct access to those oxygen users, so they're a great strategic partner. So
yeah, that's actually going to be where I was headed. So again, you're kind of one step ahead of my questions here, but I was going to say, why would they give up that revenue stream, right? So maybe there's potentially a rev share on the back end or something you can work out. But yeah, I mean, I would see it more as a selling point than a full on 100% revenue stream into the company. But sounds like you're thinking about that already.
yeah, so we work with Carrie Nixon for like our reimbursement strategy, but she can also do our contracts too. So it's just important that we have it spelled out in our contracts and who is going to be doing that monitoring, either us or if it is like a CareLink or something, that they'll do their own.
Great. Thank you. And next we have Rupert. What would you like to share with Valerie?
Yeah, Valerie, I'm not a device expert by any stretch, and I tend to look at things more from a drug development point of view. I thought your presentation was great, by the way. So it was very clear, and as the previous reviewers said, you hit a lot of the key points. I was wondering about competition. You went straight to competition. But the question I have is just, and maybe this isn't relevant to this type of approval, but I understand, obviously, as a physician, that being able to monitor these things is important and useful. But what's the sort of impact on patient outcome in the end? Is that something that you have to be concerned about or generate data for? Are you required to show that, by continuously monitoring, you get, I don't know, better compliance, better outcomes, fewer exacerbations, et cetera, et cetera, et cetera? Or is that just stuff you can sort of collect and put in a publication that supports the product?
Right. So with our pilot studies right now, we're more validating the solution with the pilot study with Henry Ford. With our pilot study that we're working with CareLink, it's going to be able to dive in a little bit. So it's going to be a longer study, and it's going to have a more patients involved into it as well. And we've talked about this, we're not sure on because ideally, what I would like to show is that I'd like to show that I could reduce hospital readmissions, is
Exactly.
what I would like to be able to prove. But I've heard that it is such a pretty large size study that you would need to do to validate that. So we have to kind of take baby steps, but eventually I think we'll be able to prove that. I think it's really important though too to recognize that when patients are sent home with oxygen, nobody helps them to titrate that. So to adjust those oxygen flows, and the oxygen, like their demands and needs change. So
Yeah.
that's why it's really important, because it helps to educate them too on their own oxygen status and to know when they need to make adjustments too, because they're kind of just sat home out on their own.
Yeah.
Yeah.
Yeah. So I'd be sort of, if you'd been kind of pitching this to me for some sort of investment, I would have been interested to hear a little bit more about what those plans might be and what kind of data, you might be planning to generate. And I wonder, in the longer run, if you get this, successfully approved and so on through the initial hurdles, there's so much good work now in real world data generation. And I don't know what the right partnership would be ultimately, but for example, we often run trials now where we have virtual real world data arms. So, cell therapies, for example, were approved. You can't randomize people to a cell therapy trial. You give people cell therapy and then you construct a control arm of very similar patients, but you extract their data from real world data sets, and you can show that you're improving the outcomes for a group of patients who look like that. So I would suspect for this type of thing, ultimately you'd be able to generate really good data like that, and I think that would really help drive up uptake and utilization of something like this. I mean, there's the peace of mind piece, there's the optimizing therapy, but if you also ultimately have a plan for generating data in that kind of setting and showing, like you said, that there are fewer hospitalizations, fewer exacerbations, I mean, that would be a very valuable thing for the for the asset. I also think pharma companies would probably be interested in deploying this into trials for COPD therapies, and there are some quite interesting, new developments in COPD therapy. There's data on something called an anti-TSLP antibody that's literally just been released by Amgen and AstraZeneca, and I think having something like this in trials like that, where you have continuous information as opposed to just discrete endpoints, could be really valuable. So just a few sort of ideas for things that you could you know, you could think about as you progress. But it looks great. It's very interesting.
Thank you. I would love to follow up with you on this and learn a little bit more. So thank you.
You're more than welcome to do that.
Excellent.
Sandra has my details. Just drop me a line, and I'd be happy to, you know, to talk to you at any time. No problem. Let's do that.
Thank you.
you.
Fabulous. Very quickly, Valerie, did you have anything in particular that you wanted to ask the panel? Was there anything burning on your end that you want their feedback on?
Yeah, well, just that I wanted to see how my pitch is, what kind of questions that were there anything else that I needed to address? Was there anything that needed to kind of improve or tweak? Because, you know, I'm getting ready, you know, to open a round of for our Series A and want to make sure that I'm conveying the message correctly and been working on it. So,
Well, so Valerie, two quick questions. Do you use a database called Dealum? Have you ever been invited to Dealum? Okay,
no.
so we should get you set up in Dealum. And then the second is, I'd be glad to break out more and answer your question in detail because the time we have now is not good, but I would challenge you on why 2 million and what's the minimum you need now to get to your next milestone. In today's funding environment, everyone's asking for 2 to 3 million.
Mhm.
You know, no one could really answer the question of why. So if you could show maybe a step up of what you need to get to the next milestone to accrue value. And I'll reinforce Rupert's point of, you know, there's a diagnostic need, yes, but what is the therapeutic need? And then can people survive COPD? You know, what is the treatment success? And if you start to do some customer discovery in that venue, I think you're going to see that Rupert was just touching the tip of the iceberg. And so there's all kinds of element on your diagnostics that could have value, especially if they could feed therapeutics in multiple windows, be it clinical trials, therapeutic success, improved outcomes. And so, yeah, those are my 2 points. I'll stop there.
I'd love to follow up with you later, Steve, too. So thank you.
I will take care of that for both of you.
Just to pepper in one last thing. Sorry.
Go ahead.
I know it's been a bit of a moving target, Valerie, with how to represent the work that's ongoing with Michigan Tech. I would pose this question to you. Is the oxygen concentrator unit important enough to the business today, right now, and its commercial success that you need to spend time explaining how that fits in with the broader context and spending some time talking about Michigan Tech? I mean, this is before even proof of concept, right? We're talking, you know, skunkworks type of stuff. At least that's how it came off to me, my opinion. So I would just be careful about how you describe that. And if it's integral and necessary to the commercial success of the business to hit inflection points that would unlock the next financing, fine. But just hone in on that, and maybe the story is a little cleaner with or without that. Just some food for thought there.
Thank you. No, I appreciate that. We're trying to show that we have like a whole line of business products, a whole line of innovative oxygen solutions is kind of like our biggest goal. We're not like a one-hit wonder. We've got.
Yeah, I love that. I would just put it on the timeline slide and kind of touch it there maybe and just say, you know, we have some other interesting IP in the work that's, you know, complementary or something like that. But
Thank you, Matt.
All right, Valerie, terrific job. Thank you so much. And by the way, Valerie is also a returning KVT alum. She presented for us many, many years ago. Boy, you've come a long way. Congratulations. Our
Hey,
next
Valerie,
presenter.
Where is home, Valerie? Where does the business operate out of?
Newaygo, Michigan.
Okay, thanks. Next up, we have Kevin Kerwin with Detect It. So Kevin, if you're ready, go ahead and pull your slides up.
Thank you, Sandra. And thank you, Valerie. Nice presentation. Let me share my screen here and get my slide over to you. I assume everyone can see that.
Yes, we are looking good. You may start whenever you're ready.
Perfect. Thank you kindly, everybody. My name's Kevin Kerwin. I'm the founder and leader of a company called Detect It, located in Oak Park, Michigan, formed in 2020. Detect It is, well, let me get on, make sure I can transfer through. So in summary, Detected is a 7-person. We've actually added an 8th and 9th here this year, founded in October of 2020. We are an AI software for manufacturing disruptive technology. We're this year a little bit north of 1.2 million in sales, probably going to cap out about 1.8. We're being adopted across 38 plants, 5 major tier ones. We're looking to project 100 million in sales over the next 5 years. And we're actually looking for a $5 million Series A investor or group of investors. Detected, the purpose of Detected is to bring the power of AI out of the clouds and out of the coders' hands and get it into the hands of engineers in the form of an engineering tool so that they can solve problems that were previously unsolvable with any existing Industry 3.0 technology, primarily in use for quality control, inventory management, and safety for operators. So we are bringing the power of AI out of the coders' hands, get it out of the clouds, and get it over into the hands of engineers that are not coders that can use this technology to better their production processes. And this crosses many market verticals, not just automotive manufacturing. We currently have some West Side Michigan, medical implant manufacturers that are going to be looking at our stuff, as well as medical device manufacturers using our technology as well. The problem here is, and I've seen this, my background is a million years in manufacturing, basically 40 some odd years. I'm an entrepreneur my whole life. And I've seen the same problems at every manufacturer. I don't care what market vertical we go in. It's quality, costing manufacturers lots of money. People lose 10 to 40% of their sales on quality issues. Ford had 4.166 billion in warranty claims. If you want to just look at that, 5.7%, 5 to 7% of money is spent by companies on systems to catch bad parts before they get out, or air proofing, but bad parts are still getting out. Half the time, the reason the bad parts are still getting out, I don't care how much money they spend to try to contain and catch and keep these bad parts from getting out, they get out. And the reason they get out is people. 90% of everything is a people issue. With people make mistakes. We are the best inspectors and detectors, but God made us great, but he didn't make us perfect. And in that imperfection lies bad parts getting out of the door. A lot of the error-proofing systems get bypassed and people get put on it. So 23% of all downtime, unplanned downtime, the most expensive stuff. 45% of manufacturers know they can improve, and almost all of them have had downtime in one fashion or another. And we're trying to eliminate that with AI for error-proofing, quality control, and also predictive maintenance. So the solution is human level vision or detection without the mistakes that people make. Use the AI technology that's available to coders and available to Googles and Amazons, and get it down into the engineers' hands so they can implement error-proofing solutions that have the level of human level of detection, but without the mistakes they make. All of our technology uses low cost. We're a software platform. We're like AutoCAD for AI for engineers, basically. We use any camera that's available, from security cameras to $50 borescopes to $1,600 pan tilt zoom cameras. And we're all on-prem, secure, running in high-speed, reliable environment. Why now? Well, we have worker shortages. The technology's actually been out there for a while, not in the hands of engineers. Systems are affordable, computers are affordable. The existing level of technology being used in the industry is outdated and not working. Obviously, we still have bad parts getting out. And a lot of times AI is confusing, or neural net technology is confusing for the engineering world. They're not plugged into it as much as the coding world is. So they don't know as much. It tends to be like, well, I don't understand it. So, and engineers, if they don't understand it, they usually won't adopt it. So get this stuff into their hands as like an engineering tool, similar to AutoCAD or SolidWorks. The market is huge. We have a serviceable market of over 4.7 billion. A lot of it busts up into predictive maintenance, which we're good at doing. We can tell when stuff is starting to wear. We can tell when stuff is starting to get out of adjustment. There's a bunch of applications for object recognition and classification. So there's a lot of areas that our technology can roll out and disrupt the existing dominant market players. We are actually in phase 3. We've completed phase 1, our business development. We've built a sales network and a preferred partner channel network as well, beyond the end users that are selling our stuff to other places and integrating it themselves in their own products. We're white labeled underneath some people's products in our preferred partners. So we're looking to scale and integrate. We're ready to go to the market. The product is pretty much done. We have all other products coming, accoutrements and so forth, but we need to scale and integrate, expand internationally. I need to get over to Europe and beyond and into adjacent markets. Our product is very simple. It's literally, if you can take a video, draw a box around something in that video and define what you want the neural net to learn by drawing boxes around items in a video, the system will learn. It's coder free. You don't need to know anything about neural nets, AI, coding, anything. It's like AutoCAD. You don't need to know anything about drafting techniques in order to use AutoCAD to draw. It runs on Windows or Linux, and it is video based, not picture based. There is a brief main menu: collect data, label your data, train your neural nets, deploy your neural nets, and run them. The main menu of the builder product. Our competition is it looks like this. So I am on-prem and I'm affordable, meaning that I sit on the floor of the plant or in the IT room. I'm not a cloud solution, which doesn't bode well in the manufacturing environments. They need everything to be on-prem. My competitors in the existing world are Key and Cognex, huge companies that make machine vision systems. Their biggest issue is their hardware manufacturers. They are deathly afraid of this technology because it decimates their hardware. You can use any camera. You don't need to use their $2,000, $4,000, $6,000, $8,000, $12,000 cameras. You can use a $50 camera or $1,600 camera. You have Google, Amazon, Microsoft. Those guys understand this technology, but they come at it with a cloud approach, which doesn't work in our manufacturing environments, cloud to edge. And then you have some other startups that are not based in the Detroit area, grow up in the dirt of Detroit and automotives and all that. They're out west. They're in California. They're in life sciences. They're doing grading fruit. They're doing agriculture with this. A lot of times they also are a SaaS or cloud-based system. Our advantages is, number one, we are video-based. Everybody in my market currently today takes a picture and tries to figure out what's going on in the picture. We're running live on video feeds anywhere from 30 frames a second to 300. We're coder free. Most of the other applications, anything out there, you have to have some level of coding knowledge. We automated one of the hardest parts of neural net training, and that is labeling the data with tracking mechanisms. We're on-prem, which is what my customers want. They don't want clouds. We're fast, extremely, written in C++, so I can do bottling lines or I can do car parts, high speed. And we were born out of the experience of automotive manufacturing with our team here in Oak Park. I knew what I wanted to bring to market. I spent a number of years writing this tool. Our end users, our business model, we sell direct to end users. It's a license fee, and they have 100% renewal every year. And they also have to pay project fees as they develop projects with us. And we have digital delivery. These are some of our major tiers that are adopting our technology. My preferred partner network, or what I'll call a certified integrator network, we're growing. This is just a few of them. These are people who build stuff and sell stuff to other people, and they embed us inside their solutions and use us. So again, that's a license-based model. They have to pay for every project they do, and they have to pay for the software each year. My team is me, my background, entrepreneur my whole life. my senior software architect, principal software architect, Mr. Zach Davis, basically the genius behind most of the stuff. Rick is sitting in the room with me, head of marketing and sales. And then I have Jacob O'Boyle, a senior software developer that joined us many years ago to form the base of our team. Our technology is proven. It's ready to scale. It is out there, 1.2 million so far, more to come this year, 38 plants, more to come. We were chosen over Amazon in their green grass solutions by Magna as a standard. And we have 4 patents filed. 1 is fully approved. The main patent on our base technology is fully approved. 3 others are in process still.
Okay, you're at 11 minutes. Please wrap up.
Go ahead. Where financials look something like this for over time. Our KPIs don't take long to get customers on board. End users 2 to 4 months. Preferred partners 1 to 2 months to get them on board with our software. Global footprint looks like this, where we've deployed, where we're working to get deployed, and who's in process in the pipeline. We're looking for a Series A, self-funded today to $2 million. That Series A will give us 18 months growth and runway to expand our marketing. So most of that money will get used for sales and marketing, some working capital, some general admin, and still some research and development. But we're ready to go to market. We need to hire sales and marketing people across the country.
Okay.
If you'd like to contact us, this is our thing, and there's no disclaimers in this presentation, I promise. So let me stop sharing my screen, and I will come back to you all on the Teams meeting.
Thank you. Thank you, Kevin. Awesome. Matt, we are going to lead off with you this time. Where are you? There you are.
Hey, Kevin. That's good to see you again. I think we reconnected maybe a couple of years ago when you were, just getting this off the ground. So, congrats on the traction.
Thank you.
So we hear AI is everywhere nowadays. I mean, you were ahead of the curve, building these no-code AI systems off of simple visual video tracking, well before generative AI was a household thing. Because of that, though, you're positioning yourself, and I think, rightly so, that you've got embedded with some, key customer accounts. You've got a channel partner base. You're projecting some steep growth over the next couple of years. I really would like to see more data. So, you mentioned the problem, and I think that problem's real for sure. We're seeing a lot of companies throw a lot of money at this. But, do you have case studies you can point to showing improvements in quality? Do you have, reduction in FTEs, whatever it might be, whatever metrics are relevant to your industry? I think seeing those case studies would be, in one form or another. It could be across your customer base, or it could be one particular, instance where you've knocked it out of the park. That's gonna provide some rooting your audience and your investors in reality, because everybody promises the world with AI, and you've done that, but you've actually, very importantly, practically achieved some of these things, right? And since you're positioning your company as getting ready for scale, I think it does become relevant to talk about margins, what % of your revenue streams are subscription versus implementation. You do have integration partners, so it's important for us at a first glance to understand, kind of what the cash flow and the revenue makeup of this business is going to be going forward. So I would push you a little bit further than just, problem solution, market fit. I think you did a great job characterizing the competition and making that point of being on-premise is important, how you're differentiated. But the data speaks louder than words, especially if you're displacing folks like Amazon. That's really, really powerful. So, I think the presentation was fine, and the company's seems to be headed in the right direction here. One thing that did catch my eye is, it looks like your EBITDA is still going to be, in the negative $2-ish million range. We saw the financials for just a second, but I'd like to unpack that, if we have time. But
so what we're looking at, that EBITDA, that chart you saw, and I can pass it on, is what we were going to do with the 5 million. So if I get $5 million, I'm hiring a whole bunch of sales people across the country, and I'm going to go negative, right? Because I need to front load this. So I'm going negative to the tune of almost 4.4 million on the second year. because we're hiring, expanding. Now, the third year, things start to, year 2.5 and beyond, things start to climb and you start to make money, but it's going to cost us money to get out there for a while.
No, I think that's understandable. Especially because there is, some integration element here, right? And so you've got to work with those partners, which is going to take some margin. Just be prepared to answer questions about how do you get to profitability. That's been a big shift in the last couple of years, where it used to be growth at all costs. Just put your name out there. Burn capital. Who cares? There's more coming, and that's not reality anymore. And so I think just hedging against that might be helpful.
Hey,
I do
Matt,
have other
may I interject and say it was never
to
reality.
get there, right, in the business plan. But I also do have some testimonials on my website. I probably should put them in there. But like 30% increase in production rate by eliminating the final inspectors who were making mistakes and were the bottleneck. They eliminated the final inspector. They saw a 30% increase in production, and they don't have any bad parts coming back. That's one case study. I've got another one where the UAW people are asking, when are we getting detected at our station? Because they don't want to make mistakes, right? People don't really like making mistakes, but they do. So they want to know when they're going to get something there that watches to make sure that they don't screw stuff up, right? And so that was an interesting testimonial.
No, I think it's that's great. Testimonials are super powerful. I guess just to bring it home, now that I've had a little time to digest my own words here, things like payback period, things around what's the switching cost, stuff like that is really good data to have, because it helps us as investors understand, how you turn this more into a hockey stick style business. But
Great.
yeah, well done. Yeah.
Thank you.
Thanks,
and we
Matt.
need to keep moving because Rupert has some really nice things to share with us, I'm sure. Go ahead, Rupert.
Well, so this resonated with me because of all the recalls I have had on my Ford Explorer. And I think Matt's feedback was spot on. Kevin, your intro reminds me very much of trying to get AI into drug discovery, medicinal chemistry, where, we have a very similar sort of proud group of experts like you do in engineering, and trying to persuade people to adopt something that they think is a sort of variation on what they've been doing for years, and they sort of don't understand it and mistrustful. Absolutely rang a bell with me. I think the concept of, to get investment in, my last job to sort of support this, I'll come back to what Matt said, which is showing the benefit in multiple ways, actually. And you say you have the testimonials. I haven't looked at your website, but I think getting those in. So, we had to show, for example, how quickly could we go from our initial chemical finding to, a drug, and, we could actually shrink that, by 50%. We could look at the number of molecules we had to make to get there. And we didn't always sell this back to our organization as, this means we can do the same thing with lots fewer people. We often said this means we can do more things better with the same number of people, which sort of took a little bit of the fear out of it. So I think that, since you're obviously being very successful already getting this in, I absolutely agree that having some examples so that new customers will adopt it and they can see what the value is from different perspectives would be hugely powerful. So I would echo that. But apart from that, I mean, it was an education for me, because I don't work in a manufacturing space. But very nice presentation, super interesting, and congratulations on the success you've had to date. But build it out with a few more vignettes.
Yeah,
and I think,
ROIs, typical ROIs for my customers have been about 9 months, but I need a testimonial on that. It's hard to get some of these customers to sign their name to any testimonial. They'll give it to you, but it's got to be anonymous, because
just use the
presumably
use the
you're
data,
generating,
just use the financials.
Yeah, you're generating data yourself too, right? Will they not share data back with you? And also, that the one other thing I wondered is, I mean, presumably you're ability to do this gets better and better and better the more customers that you have and the more experience you can put back into the algorithm. I mean, that's usually one of the strengths of any AI driven
Yeah, no, my
approach.
customers have been a great source of new ideas for our product. So
Right,
great.
right. So you start to
New
form a
ideas.
sort of community that's ever improving, and maybe that's another good point to build in as well. Very
Thank you
nice.
very much, Rupert.
Great. Really insightful. Thank you. And last but not least, Steve, chime in, please.
Kevin, you're definitely a manufacturing guy. There's no question about it. So that comes through really well in your presentation. Is the AI black box or white box?
It is a white box solution. In other words, I don't make the neural nets. I support many different types that are out there. We may make our own at some point because I do understand how they are structured and made, but we support many different type of neural net structures, although I default you to what we feel is the best currently out there.
Yeah, so the AI is this magic word, buzzword. It's ubiquitous and obtuse all at the same time. And one of the things that we're finding for the people who are succeeding is they simplified their story. And you're almost there. I think you heard from Matt, you heard from Rupert, some real life case studies, examples. And I'll give you an example. Way back yonder, one of the first companies we had was an energy efficient lighting company. And LED lights were just being heard and no one knew anything about them. Yeah. So when we explained the LED lights in a simple format, and then used real numbers that you could go to a gas station, buy this stuff, get a rebate, and pay it back in 9 months, and it wasn't voodoo physics, then all of a sudden, no one was talking about lights and LED. They were talking about their business. And I think that would help with these case studies of, yeah, you're AI, but you're really improving their business. And here's how you're going to do it, and here's how you're going to save money. The other thing is, you say 1.2 million in sales. As an investor, the first thing I ask is, yeah, how much are you making? So what are you making right now? And 1.2 million.
So on that 1.2 million, we're running about a 680 gross net on that before EBITDA. So
and that's good. So I would promote that as well. And then you heard me say this to Valerie, and I couldn't help but interject when Matt said, no, the world's changed. Just don't buy the money and blow it up. That's not reality. And I would suggest that was never reality. It could work in certain areas, but so what do you really need? I know you want to blow this thing up. I know you'd like to get all these salespeople, but as an investor, and I'm here 5 million, I go, what do you really need? So what do you really need to grow sales? Why not a manufacturing reps? Why internal sales versus external sales? I would drill into your sales model big time, because at the end of the day, you have no business without a sales model. And then the last thing is, have you heard of companies like Liberty Reach?
I have not.
So they're using video to pick and place parts instead of, so you can present the parts in any format. A robot arm comes in.
Yeah. Bin picking and stuff like that. Yep.
There's companies like that potentially you could assist, because when I look at quality control, it's when I handle the part. And so static AI is okay, but I think you're going to need more of a fluid motion. But it's a good idea, Kevin. I think your timing is on target. There's some folks I'd be glad to introduce you to that are very proactive in manufacturing and be able to give you great feedback too. Maybe even give you a chance to do on test sites. Bedrock.
Yeah, a lot of times you got to do a proof of concept. It don't work unless it works on my concrete, right? And so you do the proof of concrete.
Yeah, I think you'll also find, Kevin, that they're looking at stuff. These folks don't stand still, and you're going to learn from them too on what they're looking at. You may want to reach out to Bedrock and their smart parking lab and just network with them, because they're doing all kinds of stuff in these venues, and it'll give you just a different level of exposure. But it's a good start, Kevin. Great job. I agree with Rupert. Impressive. Keep going.
We're working on it, man, knocking them dead each day. But I could grow less with less money, right? It's just primarily getting out there, getting the brand, going to shows, getting people on board, establishing partner networks in different parts of the country and for different manufacturing verticals, right? It could be food and beverage, it could be medical devices, It could be aerospace and defense, manufacturing. I mean, I just turned in a bid to the DOD last night for $2 million of better object recognition with less data, coder free, because they need stuff that allows them to take advantage of the AI without having to have coders, because the military, I guess, doesn't have the kind of coders that the rest of the world might have. But you don't need coders. You just need people who can take video, draw boxes, and train neural nets to detect things. So
Good job. Thank you.
thank you.
Well, we're going to keep things on track and head right into our last presentation of the day. Samir Mansour is with us from BeAwar. So Samir, do you have your slides ready? And you can unmute yourself.
Those are really good presentations, Kevin and Ayers. Great work, Valerie. Hello, everyone.
Wait, not yet. We're not. Oh, wait a minute.
Oh.
Are you in presentation mode?
Yes.
We're still seeing. Oh, there we go. Maybe a little bit of a lag. Okay, we can see and we can hear. So whenever you're ready, you can begin.
Good morning, everyone. I'm Samir Mansour. Thank you so much for taking the time to meet with me today. I'm excited to introduce you all to conference captioning, where every voice finds a stage. Meet Jason. He's a talented software engineer who's deaf. He loves attending tech conferences to learn and network, but he feels isolated and frustrated because he can't follow discussions well. Despite his passion and skills, he misses out on information and opportunities because the events are not accessible for his needs. Well, overcoming barriers to inclusion is a very common challenge at live events. Individuals requesting accommodations always face inadequate accommodations, and they often only receive an apology and occasionally a refund. Disability is a spectrum. What do event organizers do today? Live sign language interpreters, right? Well, they're too expensive. They cost over $100 an hour. They're hard to organize, and they don't provide accessibility for the majority of older folks, hard of hearing, those with cognitive challenges who don't know sign language. And accessibility for non-native speakers is usually just ignored. The current solutions are just too expensive, complicated for event organizers, leading to a negative overall event experience. Luckily, this year, Jason's favorite tech conference just announced that they're using conference captioning. And for the first time, Jason could attend and follow every presentation and participate in discussions all in real time. He felt included, valued, and empowered. He said he could even teach so many things he learned back to his friends that didn't attend. Conference captioning offers a comprehensive solution that's being provisionally patented. As you can see in the pictures, it's versatile, supports various event types from conferences to group trainings to even airport PA systems, making it an ideal solution for diverse needs. Upon downloading the app, it takes just 15 seconds for the speaker to create a stream. They share that QR code and bam, people are able to begin streaming captions and live translations in the phones of thousands instantly. There are over 1.5 billion people who are deaf or hard of hearing, just like Jason. Isn't that unbelievable? That's one person for every 3 households in every city and every neighborhood. And with the baby boomers aging and the increase of life expectancy everywhere, our user base will double in just 25 years. Based on the Convention Industry Council, 1.8 million live 1.8 live in-person meetings, trade shows, and conventions are held in the US annually, 1.8 million. So we use that number to estimate that 1 million live events globally could use our product for our TAM. Our SAM is what we can realistically target for events that would find value in our solution. And then our SOM represents the portion of the market that we can capture in a few years. keeping in mind factors such as market penetration, competition, market readiness. And then the beachhead is that tiny segment that we can corner at least 40% of the market in a few years that view this as a pants on fire problem. Well, what does our competition look like? Venture-backed AVA is inexpensive, but they don't provide translations. Understandably so, because live translations has been an expensive process. The venture-backed Otter AI provides translations, but they aren't focused on accessibility, nor do they provide ease of setup. And unlike the others, Wordly, with its slow pace and focus on in-person events, is slowly creeping its way in the live translation space, having just crossed 3 million people reached a few months ago. But they're extremely expensive to afford, costing over $50 an hour. But what we do that matters to our customers is ease of setup and use. They don't want training and they don't want to train users on how to use it. And our customizability and focus on maximizing accessibility are things that they love. While our users are people who are deaf or hard of hearing, or people who speak a different language, our customers are motivated by different factors. They either care about bringing more people out, or they might be mandated by law to provide accessibility. Some others are gladly paying $100 an hour, but they need a way to cut down their costs. We started early 2023, and by the end of 2023, we had our first paying client. We were at the CES Las Vegas at the beginning of 2024, where we were able to secure a paid partnership through the trade show, and we're currently piloting some custom features with another customer. We are focused on sales, and we're trying to grow and keep that momentum going. This is what we've been using currently. Our SEO and target internet ads has been helping us with our inbound sales strategy. We're looking to, obviously, just like everyone else, partner with influencers and social media. We have found success with partnering with accessibility tech solution providers that are already providing accessibility technology for other companies, and also with event ticketing platforms that can add it as an add-on to their event organizers that want to use their ticketing platform. Our primary revenue model is a simple subscription. We provide a 7-day free trial targeted at event organizers. Our monthly plan pricing is $400 a month for a 1-year commitment. It includes one stream that can cater to unlimited users. The app is free to download. Our customized plans without the yearly commitment are much higher. We also have a few additional revenue streams through enterprise organizations that are licensing our software for their existing solutions. We have a rockstar team. Oh, where'd the picture go in the middle? Oh, there we go. we have a rockstar team that is pushing on every front to improve, grow, and provide an amazing experience. We put in several sleepless nights trying to meet tight deadlines, and we just need your support to help us grow and expand. I have deep expertise and experience in building tech for accessibility, and especially for the deaf. Fadua is our CTO and chief scientist. She's experienced in developing and maintaining enterprise applications, and her stuff is multilingual, which helps us quite a bit with our translations and verifications. Amr is a specialist in negotiations, finance, contracts, and managing teams. His strong nonprofit network has been helping us a lot with introductions that have been turning into pilots. The figures here in our projections are in thousands, and we use conservative estimates, obviously. But what we make money on our revenue is based on subscriptions that we sell. Currently, we discount our price to 50% for nonprofits. But our pricing in general is going to be increasing by 2026. And yeah, our cloud costs are pretty low because there aren't that many simultaneous events. So the load on our servers is pretty low. And the way that we've designed our product is so that our cost is extremely low. Yeah, So I put in quite a bit of money into this, and I've also got some money through pitch competitions that I've won in the past. And this, our ask is $1.25 million. There is a lot of room for improving our product, even though our product is the best in the market right now, but there's still so much improvement that's possible. And yeah, we want to keep expanding our customer reach. There's a lot of opportunity in libraries and embassies across the world that are looking to add accessibility and live translations to their events. And yeah, we're hoping to be sold by a larger company like Eventbrite or Meetup. That, ladies and gentlemen, is BeAware's conference captioning. We'd love for you to follow us on social media so you can get the latest updates on our journey. It is my first time doing an investor pitch for conference captioning, so I would love your constructive feedback. Thank you.
Thank you, Summer. That was really interesting. And we are going to start right off with Rupert this time. Rupert, share your thoughts, please.
Yeah, I thought this was really great and very, very interesting and clearly a huge unmet need. I really liked the way that you personalized it with a story at the beginning, because I think, that's, you could probably even use more examples like that, because I think it really brings it home. As you presented, my main question was really, where do you go with this? And then you answered it with the very last line of because although I don't have much experience with this type of thing, I do know that in the world where you're building sort of apps and software and things like that, there's a very sort of rapid acquisition. I sit on the board of a life science tools company, and it's very similar. They just buy tools and then aggregate them and then include them in part of their offering. So I can see how that would be a place where when you've built this to a certain sort of size and mass, one of these companies is going to say, oh, we run all these things, we should have this as a core part of our offering. So that kind of made good sense to me. I don't know exactly what the inflection point for you is in terms of achieving that goal and reaching that exit strategy. Maybe you could talk about that a little bit more, because my guess is that if you're going to attract investors, they probably want to know sort of, again, I tend to look at all these things based on my own experience, like everybody does. I mean, in drug development, we have a thing called proof of concept, where we get clinical data, and that tends to be a huge inflection point for anybody who's trying to sell to one of the larger companies. And I guess there must be some similar sort of point here, and maybe you could explain what that is, so that people who are looking to invest have a sense of what's the timeline and what are they looking for to get to that point. So those are just some of my thoughts. But I mean, it's wonderful that you're doing this. It's such a huge benefit to people who want to attend events all over the place. And does it work? It would work online too, I guess, right? Because so many meetings are online now.
Yes, it would work online too, but it's not meant for online meetings.
Right.
Yeah.
Okay.
It would work in so many different situations, but yeah, our focus is live in-person
meetings.
events that still happen. Like people go to church every single week.
Oh yeah. No, there's
You know what I
and
mean?
it's all come back a lot.
Yes.
Since the pandemic ended. Yeah. So maybe you just say a couple of words about what you think is the sort of tipping point for getting to that exit. I'd be interested to understand that.
Yeah, that's a great point.
Excellent. Thank you, Rupert. Well done. We are going to jump to Steve now. Steve, share with us.
So Samir, how often have you presented this?
So I've done pitch competitions, like a 3-minute pitch competition, but I've never done like an investor pitch deck. So I didn't have a lot of the stuff. So, like I literally have to have 2 meetings with Sandra.
You come across very comfortable. The classic hook at the beginning. It's the story. It's good. You're very comfortable with it. So continue to do that. a couple of quick questions on the app itself. Can it do language translation in addition to, helping people hear things they can't hear today?
Yeah, it does that. Like it does live translations. So like if you look in the picture at the bottom, I mean it's kind of small, but there's a little language thing. So you can choose which language you want to translate from. You can speak in German. You can be at a German speaking event and you can translate it to French or English or whatever. Yeah, it does it today. This is actually a conference, Lambda Days. It's in Poland.
So that value prop could potentially be highlighted even earlier. How does it compare to, you see these small short videos, and there's one where someone holds out their phone and they speak in English, and then the folks hear back in Mandarin and they start laughing, and then the folks speak in Mandarin, it comes back in English. So how does it compare to some things that already exist out there that do
Yes,
that? I
okay.
speak in my native tongue, it's translated, they hear it in their foreign tongue, and vice versa.
Yeah, that's a great question. So, wait, hold on. Let me try to silence notifications. But I mean, like, there's a lot of different features in here. One of them is if you see that little audio icon to the right of the language over there, it's a little small, but what you can do is you can tap that icon and it will read out whatever the person has said into your Bluetooth hearing aids or your AirPods, for example. So, instead of looking down on your phone during the conference, you can just look up at the person and it will read out what that person is saying in your language.
Interesting.
Yeah, it also actually works with a Braille keyboard. So if you integrate, like a lot of people who are deaf and blind, they'll have a Braille keyboard that's connected to their smartphone. That's how they control their phones. And so you can even have like they can read what the person is saying in Braille in real time as well, in their language.
Yeah, and I'm looking up something here. I apologize. But now they have these audio computers. I can't remember the name. Have you heard of these audio computers?
Yes, yeah. There's a ton out there. So the problem with all the solutions out there, and one of the main reasons why I believe so much in this product is they all require, none of them have servers that store the data. You have to have really good audio quality in order to capture what the person is speaking. So when you're in a big room, like a classroom, students in the back have, no matter what app they're using, no matter what device they're using, they can't capture what the person is saying. So you have to use, have it at the speaker level or the organizer level. And none of these tools out there like provide it, as a QR code where people can scan and read it on their phones with their font size. People who are older usually have a bigger font size that they select. It essentially provides all that accessibility with the comfort of the user's own device.
So, Sandra, I can't help but think that all three teams, but Samir, you in particular, would benefit from customer discovery. Because Samir, this is an unmet need. There is potential. The market can move quickly, but it's going to be hyper competitive. When I show you some of the things, these audio computers and some of these language translators, you'll see that there's a lot of competition moving in different spaces. But it would be curious to see how you compare and where the value proposition resides. There's definitely an unmet need. I think the bigger unmet need is when I went to Asia every 6 weeks, I never got to know the person I was sitting next to, because language is cultural, language is personal, language is a personality. And I think if you do customer discovery, you're going to hear that not only do I want to speak in English and the person hears in German, but they want to hear how I speak and what my personality is. And yes, there's a lot of people who can't hear well. There's a lot of people, but wait till you see these audio computers and the earbuds they come up with now. And some of the hearing aids are already doing some of the things, but they need your app, right? Or do they? So it's an unmet need. I think you carried yourself well. You present well. I think you hit some of the key elements, but there's a lot of competition out here that you really want to get close to quickly.
Yep, certainly. Certainly.
Good.
Yeah.
Thank you,
Yeah.
Steve. Really
Yeah.
good feedback. Go
We
ahead.
actually built an app for the deaf and hard of hearing called the Deaf Assistant. And, just like you mentioned, a lot of those tools are just like that. So people try to use that app in classrooms. People try to use that app at live in-person events like a conference. And when they were like, oh, it's not really working. I'm like, yeah, like it's not meant to work that way. You need something different for it. And so we built this tool for specifically that purpose.
There's a company, they called themselves Deaf Tech. They had an app that would help parents who spoke train their deaf children, and a lot of interaction. It was an educational tool and ed tech, but it's an underserviced market. That's what I learned with that company. And you could just have a nice niche there.
Certainly. Certainly.
All right. And keeping the ball rolling. Next we go to Matt. You're going to bring it home and wrap it up for us. What's your thought?
Sounds good. It better be profound, right? No, great feedback so far. And did you pivot from medical? Is that where you started here?
Yes.
Yeah,
Yeah,
this
did
is
quite a
an
bit of
interesting
medical stuff.
pivot. Yeah, because I am familiar with the company, the earlier iteration. So I like the direction you're headed. So, but I do think points about competition are valid, right? So is it realistic that you're going to outcompete Google Translate for one-on-one conversations? Probably not. Are you going to outcompete
Exactly.
Otter or Zoom, for online meetings? Probably not. And so what
Exactly.
that means is, where do you have a foothold that you can protect a competitive niche and provide a long-term advantage, and how do you capitalize on that advantage in a fast-moving market, right? And so what I like
Yes.
about this pitch and the way that you're positioning the product is, um, start with a community that has a hair on fire problem, and then go wide. And so then you start, given that you have some secret sauce here about making this distributable at an event, because I'm assuming that the speaker's audio device is the one that's actually capturing the audio. So you have extremely high audio quality, and then it's disseminating that in real time to the devices, right? That's how it works.
Yes, that is correct.
Which is great. I think that's super smart. And I think there's a lot of value there for the reasons that everyone's been discussing. I would recommend you think about and focus your customer discovery efforts and your strategy efforts around, how do I capture as much of the in-person event with hard of hearing people, or people that have accessibility challenges. How do I capture that as fast as possible, cement those relationships, and become the standard of care for all those events going forward? I don't know if that means partnering with, I could see it could be an interesting relationship with the people that provide all of the ASL interpreters. They may like you, they may hate you. I don't know yet. That's something to explore, because it could be synergistic, right? But how do you partner with different trade associations, with event planning associations, advocacy groups for accessibility, to become a recommended and a standard solution such that you get incorporated kind of automatically, and you get your footprint quickly, and you've got stickiness with those customers. But then, man, this has got huge potential, right? So would I use a solution that live transcripts every event that I go to, and then stores those notes on my phone so that I can look at them later? I mean, how many times are you people scribbling to capture something that a keynote speaker is saying at a conference, right? And so you can start there, become the standard tool, and then grow from there. But you've got a competitive foothold and a baseline to underlie the business, and provide you with kind of a captive market. And I think that's something that's going to become really important as this market moves really fast, and these solutions continue to get better and better and better. Because it's not necessarily that you're going to outcompete them on the quality of the translation or the audio pickup. It's more of the creature comforts and the things that make this practical for events. So keep going. I like it. Just try to focus on how you can get that foothold as quickly as possible.
Yeah, thank you. Great points. I feel like you really understood it well. I mean, one thing that where we're seeing a lot of opportunity is so we're using our custom language models that we use the more famous ones, and we are able to build it on the person's device, which keeps our cloud costs super low. And we are really good at when people speak a single specific language and they add another language into it. So Spanglish, for example, or even like, people who go to the mosque, they speak in English, but they add Arabic words to it. So we're able to transcribe those situations really well, where in the past it would, transcribers would get really just confused of like, hey, what's going on over here? And so, like the Austin Public Library actually reached out to us, and we're like in conversation with them. They want to use it across their 25 different libraries that they have. And it's interesting, it's a ride, see how it goes.
Great. Awesome. Thank you. Thank you. So I first of all would like to thank all of our presenters today. Thank you all for sharing your really innovative companies with us. It's just always fascinating to see what incredible innovations are happening in Michigan across all kinds of industries. Today was no exception. So thank you everyone for sharing with us. And also a big round of applause and thank you to our investor panel. You guys provide great, thoughtful insight and feedback and really help make this a great learning opportunity for the presenters and for those of us in the audience just listening and learning as we go along. So thank you for that. Lastly, thank you to all the rest of you in the audience for joining us today. And I do hope you'll consider joining us again. Our next Kalamazoo Venture Tuesday will happen on October 29th. As always, the meeting will feature 3 new companies that'll be presenting, and we'll have 3 fresh investors ready to lend their insights. I have dropped our link into the chat, so feel free to copy that, take you to our website where you'll find our calendar. Again, thank you to everyone for your participation and your attendance. I hope you have an absolutely wonderful day, and I do hope to see you next time. Thank you.
Thank you, Sandra.
Great job, companies.